Throat cancer generally means that the cancer has arisen in what we call the oropharynx. So technically, we call it the oropharynx, but the pharynx, I've let somebody say that. The pharynx is simply put like a passage that runs behind the nose. So when it's behind the nose, we call it the nasopharynx. So or you want to call it nose pharynx. When it's behind the mouth or the oral cavity, it's called the oropharynx. And when it's behind the larynx, we can call it laryngopharynx, that's the voice box, or we call it hypopharynx. And that's sometimes, and that is what explains if you put a nose drop in the nose, you sometimes can taste it in your mouth and it goes down. So throat cancers, in this case, I gather you're talking about cancers that are HPV related. So yes, HPV can cause many cancers, or important cancers, one of which is cervical cancer, anal cancer, and oropharyngeal cancer. And funny enough, it's the same virus that tends to cause all three cancers.
What exactly is HPV?
Alright, so human papillomavirus is a DNA virus that is transmitted through contact, sexually transmitted in most cases. Right, so don't put this on, don't call this, put this penis to the cervix. So that's how a lot of survive. Anything nice. Right. So the penis has the HPV on it. For some reason, we are able to clear it more times than not than the women, but the women are not able to clear it as well as the men are. All right. So the HPV inoculates the oropharynx in a similar fashion that it inoculates the cervix as well.
How common is throat cancer, and have you observed any trends in recent years?
I don't have the raw statistics, so I don't know if that will help as much as you would like, but the trends are increasing. Initially, about 20 to 30 years ago, for argument's sake, smoking was prevalent in society, and most cancers back then, or most throat cancers back then, were due to smoking. Fortunately, Jamaica has cut down on smoking significantly. They have banned it in public areas. So, but we still have throat cancers. And that's where the HPV comes in. Mark it, just to step back a bit. HPV is a family of about 200 viruses. And every year, we find out some new virus that exists in the HPV family. But only a few of them cause cancer. A significant amount cause cancers, but the most prevalent ones we have are the 16, the 18, and those are the ones that cause cervical, throat, and anal cancers as well.
Does HPV also cause penile cancer?
Correct. That's correct. So it can cause penile cancer as well. Not the sole cause though, so don't bear in mind, the only thing that is the sole cause of that we have found out so far, I wouldn't say sole cause, but over 90% of the cases of cervical cancer is even higher, probably 95% of the cases is HPV related, and you get that as well. Some penile cancers, I don't know if you're going to call this, but some penile cancers can be caused from other factors apart from HPV, improper hygiene, scarring, that type of thing. But throat cancers, the HPV related ones, funny enough, they are less aggressive than the ones that are caused by smoking. So, and the thing with throat cancers, only when you pick them up quite early, when I'm talking about throat, I'm talking about the oropharynx, only when you pick them up quite early is surgery an option. So you normally have the tonsils, and that's most times the most common cases where they are found. You can do a tonsillectomy and the patient is cured. But what happens, the third population, we tend to watch and wait and watch and wait and watch and wait. So by the time these patients present, the cancers are quite advanced and still curable though if they're HPV, well, even if they're not HPV related, they are still curable. But you find that the HPV ones is better than the ones that are caused by tobacco and alcohol, etc. Significantly better. And you probably can ask what the cure or how we cure them if we can offer you. Chemo and radiation. So chemo and radiation, and they responded quite well.
There have been reports that oral sex is driving an increase in throat cancers. Have you seen any evidence of this?
That would be a difficult survey, but to undertake, I mean, most people in the Jamaican society wouldn't admit to that. But just by observation, yes. Just by observation, yes. Because throat cancer was a cancer of older men, but now we're seeing a lot of throat cancers in the younger men. Most of my patients right now actually, male patients in particular, are under 60, under 50 years old. And unfortunately, I just had one who died in the last 2 weeks. And a very curable cancer, but because of social circumstances and a delay in recognizing the need for treatment, he passed. Still did very well because he was quite advanced. Also a prisoner as well. I'm not quite sure where he was. He did quite well with the chemo and the radiation, but unfortunately, once again, due to social circumstances. I want to find out with the cancers that are HPV related, they tend to have a very small primary, and that's where the cancer normally begins. It's a small primary site, and then they have these big neck nodes. So they have these big, massive neck nodes, and that's what we call the simple wax and curtain. And those patients respond excellent. I mean, the primary sometimes is so small that the ENT surgeon actually can't find the primary on several occasions.
What are the trends that you're seeing in women as it relates to throat cancer?
Strictly speaking, for the oropharynx, I haven't seen a change. What I've seen a change is in the men actually. So I haven't seen any, but that is not scientifically backed. Just being in the clinic and seeing more men.
How does engaging in oral sex increases the risk of throat cancer?
Right now, I don't think there's any published evidence, certainly not locally, but one can deduce that based on the fact that men or population has reduced their smoking habits, and the population of men who I am seeing is younger. So you smoke for over 10 years, 20 years, you get a oral cancer, oral pharyngeal cancer in your 70s. But now, they're not smoking as much, and they're getting this oral pharyngeal cancer way before 50. So one can deduce, I'm saying that society has significantly changed. But one can only deduce that oral sex has contributed and will continue to contribute to oral cancers. Oral pharyngeal cancers.
What's the youngest you've ever seen a man diagnosed with throat cancer?
Yes.
Mid-30s, yeah. But I don't want to blame that only on the HPV. There could be a genetic factor as well involved. But mid-30s, but not a many in their 40s actually. But I don't know if you can ask this, vaccine is important. If we get the vaccine on board and you want to get the vaccine, normal age is around, in women is 9 to 12. So you're going to see a reduction in all types of cancers, all types of HPV related cancers. So cervix, penile, anus, same cause for the anus, penis doing somewhere perhaps it probably doesn't normally go. And your throat, well, the oral pharyngeal cancer as well.
What are the early warning signs of throat cancer, and how can people differentiate them from common throat issues?
The warning signs would be a sore throat that's not going away. If you have a sore throat lingering for 3 months or longer, generally speaking, you would be worried about that. continue and a recurrent sore throat. That's the main thing that triggers these patients. Difficulty in swallowing, unfortunately, backs and canals or lymph nodes, blood, spitting blood continuously, halitosis, bad breath continuously. Yeah, those are the main signs actually. The earlier signs per se.
How is throat cancer typically diagnosed, and are there any advancements in diagnostic methods for early detection?
So how it's typically diagnosed. You actually visualize and take a biopsy. That's when you take off a little piece and send it to a pathologist, and they look at cancer cells on the slide. Most recently, we can do DNA specific tests. So we can do blood tests, but that's not mainstream as yet. And what we're looking for actually is viral load in the blood. So you have a throat lesion and you have increased viral load in the blood. You're thinking of HPV related or pharyngeal cancer. Yeah.
Are there any prevention methods that people can take to lower the risk of throat cancer?
Definitely.
What are some?
Just don't smoke, reduce alcohol intake. What else? Reduce that. But you see, smoking and alcohol have been around for a long time, so most of the studies are based on that. Newer studies coming out are based on HPV related. Yeah.
At what stage is surgery not an option for throat cancer?
Once you reach, generally speaking, and that's a thing for a lot of cancer, but for throat cancer, once you reach stage 2 and beyond, because you are worried about micrometastases, that is not visible to any test, or clinically you can't see it. So they're about stage 2. There's specific stages for stage 1 though. If it's close to the midline, you're going to give additional radiation. So even some cases, some stage 1 cases, they might be resectable, but when you look at the pathology report after the case has come back, you say, well, okay, even though we resected this case, we still need to go ahead and give some radiation and some chemotherapy. Yeah.
With treatment, how long does recovery normally take?
Depends on what you call recovery. So the thing with treating cancers of the head and neck in general, so remember you can have a cancer of the nose, you can have a cancer of the nasopharynx, salivary glands, etc. Nutrition is important. So the younger people tend to go a little bit better because they are more robust. But nutrition is a significant factor. How you get food inside your body, generally speaking, through your mouth. So it differs from person to person. So the salivary glands are treated with radiation as well. So you can taste the food as well. So the nutrition component is not as simple as it is. And some people end up with a tube in the tongue to help with nutrition. So to answer you by saying, you may, after 4 weeks, you're going to be back up and running, generally speaking. I don't have a definitive answer, but I could give a generalized answer. And that you might be different from me, you might be different from, I forget, bad memory. Probably about 6 weeks, you're up and running. And generally speaking, that's what we do after radiotherapy. We check you up after 6 weeks, after you've completed radiation to see how well they're doing. But that's just a ballpark figure, it's not specific to anybody personally.